So the child with Fragile X usually presents with behavior problems and developmental delay. They can be very sensitive to stimuli in the environment, sensitive to sounds, to touch, intolerant of certain textures in foods. They can be delayed in language, so they're not talking usually by age 2, and that can lead to developmental testing. They also can have social difficulties, poor eye contact, hyperactivity, hand flapping, but a lot of anxieties. Zoloft or Sertraline, the generic form, is an anti-anxiety medication. And there are some studies in autism, that is children with autism, that those under 5 have a deficiency of serotonin, the main neurotransmitter that sertraline increases the level of at the synapse. It can also calm down not only anxiety, but calm down the sensory hyperarousal that starts to emerge in the second year of life. So I found in just my clinical practice that if I didn't treat this anxiety that kids with Fragile X had, oftentimes they would develop more autistic characteristics, even full-on autism after 2 or 3 years of life. And so I started using a very low dose of sertraline, just 2.5 milligrams, in young children beginning at age 2. And I found in a follow-up study that we did that those children had far less anxiety, and their language, both expressive language and receptive language, what they understand, was much better in those that were treated with sertraline compared to those that didn't have any treatment. So that led to a grant proposal to do a controlled trial of sertraline in young children with Fragile X. So we randomized whether a child would go on low-dose sertraline or placebo, and they were treated for 6 months. And we took baseline testing of language and development, and then did follow-up testing. And lo and behold, at the end of the study, with about 55 kids that completed this study, is that those kids that were treated with sertraline had a significant improvement in many areas of development, even fine motor coordination and visual perception, compared to those that did not receive the sertraline. And their overall developmental score, their composite T-score, was much improved compared to those kids with Fragile X who had the placebo. And then when we looked at the subgroup of kids with Fragile X who had Fragile X plus autism together, and about 60% of young children with Fragile X syndrome have autism too, that those with autism and Fragile X had also a very significant improvement in their expressive language ability, besides visual perception, fine motor coordination, and overall development.